Welcome back to Pet Parent Veterinary Learning. How you doing, Harrison? And what pet parent question do we have today?
I'm doing well, Steven, and today Beanie sent us a bark mail. They're a 1.5-year-old male Rottweiler with bilateral cherry eye. First, what is cherry eye?
Well, Beanie, sorry to hear you have cherry eye and bilateral too. That's quite the bummer. Cherry eye is a nickname or slang for the veterinary term nictitating membrane. And usually it's a prolapse of the third eyelid. You see it in dogs and see it in cats, kind of when they're sleeping, their third eyelid kind of comes up. Many mammals also, like I said, cats, they have this third eyelid located inside the lower eyelid itself. And that particular eyelid also is a special gland that produces a significant portion of the eye's productive tear film. So the second you see that inflamed, your dog is probably not producing the amount of tears that really needs to keep the eye lubricated. When the gland prolapses or pops out, the condition is known as cherry eye.
Okay, well, what's the most common treatment for cherry eye, and does it ever come back after treatment?
Veterinarian will recommend a surgical procedure. It's important to treat the condition as soon as possible in order to minimize permanent damage to the eye or third eyelid gland. This is critical because the third eyelid gland, like I said, produces up to 50%, half, of the watery aqueous portion of the tear film. So in most cases, your vet will recommend, like I mentioned before, a surgical procedure. And there's many different procedures for this particular gland that prolapses. The one that you're probably taking a look on the screen is called the tucking method. And actually, they'll build a pouch, tuck it back in, close it up with a stitch, and you're back to a normal eye. And you can learn more on wikihow.com/treat cherry eye in dogs.
Well, thanks for that, Steven, and if you guys appreciated it, make sure you guys like and subscribe to the channel so you can join us next week, as Burnett sent us a bark mail who's a 2-year-old Cocker Spaniel with a foxtail problem.